All right, we are live, so welcome to the Senate Judiciary. We have 4 bills lined up for today, and we are optimistic that we can get through at least 3 of those. We would like to get through 4, since we do have quite a few bills in the hopper, and this is the last week for committee to report bills out of the committee to the committee of the whole by Friday. So we will start with the roll.
Senator Kriegel?
Here.
Senator Crum?
Here.
Senator Hicks?
Excused.
Senator Kolb?
Excused.
Chairman Olson?
Here.
You have a quorum.
All right, the first Senate file for our consideration is Senate File 157, Department of Family Services Confidentiality Amendments 2. This bill started as a mental health and vulnerable adult task force bill. Then it moved on to the judiciary, the joint judiciary, who took on the bill. It was introduced on the House side, and it failed in committee by 1 vote. What this bill does is it authorizes data sharing between the Department of Family Services and necessary parties. So those necessary parties, for example, include state agencies, but it also includes community providers that are under contract for referrals to enable services to be provided to families and in our communities. So the issues that this bill is trying to fix, currently the Department of Family Services cannot share information with the Department of Health to support some of our legislative mandates. One of those examples that was presented to me is the behavioral health redesign. Also, currently DFS cannot share information to contracted community providers for services to families in need. So instead of families having the responsibility to reach out, or rather the opportunity to reach out to community providers, so instead of the Department of Family Services reaching out to families in need, rather the community providers reaching out to the families in need. There you go, I got it that time. Families are tasked with the responsibility to reach out themselves to community providers. That results in missed opportunities for early intervention and loss of services to those families. And then lastly, the Department of Family Services is unable to analyze data such as the juvenile justice programs that we've requested specific data on, as in prior judiciary committees who heard those bills and testimony a few years back. This bill would allow DFS to use de-identified data, that's data with no name, no social security, no date of birth, etc., to analyze the data and provide responses to that data to the legislature per our requirements and mandates. That's the bill. I would also invite Director Schmidt to come up, and who's very familiar with this bill, and offer anything else regarding the bill. Welcome, Director.
Thank you, Mr. Chairman, members of the committee. My name is Corin Schmidt. I'm the Director, Wyoming Department of Health, and Mr. Chairman, you summarized that very well. At the end of the day, this is our confidentiality statutes were created in the 70s. They didn't contemplate a time when we would be able to understand and know more about the services that we are providing, the outcomes of those services, but even more so the direct connection to local providers for a earlier intervention. What we do know in what we see in child fatality cases throughout the US, there's a common theme of missed opportunity because of communication early on in the case. This is one way we can address that by being able to, for example, give public health nursing home visitation a call when we know that there's a family that maybe would like some or needs some services. They don't raise to the level of intervention by our agency, but we also know that a connection to them early on has a greater chance of reducing risk of maltreatment later. So that's one example among many, but I know that we have a packed schedule, so I'll just stand for questions.
Any questions for me or Director Schmidt? All right, thank you. And Did you want to provide some testimony, or you're just there for any questions? Okay. Senator Hicks.
Mr. Chairman, I do have a couple of questions. And so we see this language brought in on page 2, line 13. I understand the referrals for the purposes of services, but talk to me about why we would want to provide that data or information for participation in a bona fide research. What are we trying to get at there?
Director Schmidt.
Mr. Chairman, Senator Hicks, there's a few examples about bona fide research that we could give you. The first is the behavioral health redesign. And part of that redesign effort is looking at how incentive payments to providers to assist with employment and housing, for example, for clients receiving mental health and substance use disorder services, doing the research on that impact to see if that actually works. At this point, we cannot share that information with the Department of Health for clients that are in the DFS system.
So, Mr. Chairman, if I can follow up, because I've got a number of questions on this. Number one, and I'll ask this question, but specifically to your answer there's a fundamental difference between research and data collection and sharing results. And so research usually has a structured experimental design with a hypothesis and go through all of that procedures and stuff. Is that what we're talking, and typically those are statistically analyzed and provided by, most of the time we have graduate students or companies that actually collect and analyze the data, set up the experimental design. Is that what we're talking about?
Mr. Chairman, Senator Hicks, yes, that's what we're talking about.
Okay, thank you, Mr. Chairman. Then one final. So what's the difference between research and bona fide research?
Mr. Chairman, Senator Hicks, the bona fide brings in all of those elements that you just mentioned, meaning that there's a research designed, that there is a contemplation of what the hypotheses, et cetera, rather just in general research. And bona fide is found in other legal terms around the legitimacy of that research.
And so the last follow-up on this, so do we have a definition someplace else in statutes as to what quantifies bona fide research, because it's not in the bill? So is there some other statutory provision that explains exactly what you just said in the dialogue we have in this, the difference between research and bona fide research means?
Mr. Chairman, Senator Hicks, I don't know if Wyoming statutes have bona fide or defined in statute. Our intent was to define it further in rule based on the requirements around whatever the research project would be.
So, Mr. Chairman, I haven't got that far, but does the bill provide you rulemaking authority for that purpose? All right, thank you.
Yes. Yes, it does. Any other questions, committee? All right, thank you.
Thank you.
Any other agencies wishing to testify on this bill? Any public comment on this bill? Ms. Somerville?
Mr. Chairman, members of the committee, Andy Somerville, Executive Director for the Wyoming Association of Mental Health and Substance Abuse Centers, and my comments are very brief. We stand in support of this bill. We think that it's important to help the logistics behind the legislative mandate of behavioral health redesign. The DFS population has been identified as a priority population for community mental health centers. The entire idea is to get at these high-risk populations and hopefully serve them before they continue to escalate and require more intensive services. This bill would allow us to do that much better and would really bring us into operating more in a probably a more productive way for the entire state. So, Mr. Chairman, I'm happy to stand for any questions.
Questions from Ms. Somerville?
Thank you.
All right, thank you. Any other testimony?
Mr. Chairman, members of the committee, I'm Clark Fairbanks. I'm with the Wyoming Youth Service Association, a provider group that works closely with Department of Family Services and Department of Health. And I stand in support of this bill and urge your support of this. I'll give you just one example as a provider. We would provide aftercare and continued outcomes tracking of youth that we serve because we're often asked about our success. That's difficult to do longitudinally for us. We lose contact with families, they move. And so we're often, again, asked about that. And the data system does not track kids once they turn 18. So data tracking would allow us to be able to answer that question about how do kids and families who've received services do long-term. And that's just one example of how this is important. I think this is what the legislature often wants, wanting to know the successful outcomes of interventions that are provided. So with that, I would stand for any questions.
Did you say Fairbanks?
Fairbanks,
Mr.
correct.
Fairbanks, any questions for Mr. Fairbanks?
Thank you.
All right, thank you. Any other public testimony? I don't think there's any online, but I'll double check. All right. All right, with that, I will close public testimony. Committee, what is your pleasure?
Move the bill.
It's been moved by Senator Craigo. Are there any amendments to this bill?
Mr. Chairman, I don't have any amendments, but just a discussion. I see you're the prime sponsor on this bill. Was there any discussion when they were working on it? Because this is people's private information and that we're now sharing across departments. What happens if somebody doesn't want that information shared? Is that covered? In other words, this becomes kind of a mandatory provision, and it may not be in a patient's, they may not desire to have this information shared. And so was there any discussion in the development, say, is it an opt-in provision, or are we just gonna say we're gonna share your personal information across state agencies?
Senator Craigo, do you recall if the committee ever discussed an opt-in provision for this bill?
Mr. Chairman, that might be a good that might be a good question for the director. But we did talk about that. I think there's protections built into the concept to address exactly what the good senator's asking, but we could ask her exactly how that would work.
Director?
Mr. Chairman, Senator Hicks, yes, there's protections built into the legislation, again, around the rules. What we contemplated is when that permission, so if you look at the bill, it's given the director the permission to be able to authorize a particular project. We will promulgate rules around that specific project that then goes out for public comment regarding the requirements of that particular project. So if opting out is something that we want to provide, yes, we can provide it through the rules as we work through exactly the parameters of that particular release.
I just think that's so important, and when we're dealing with people's personal information, that things that'll affect their lives that at least we need to ask the question. And my preference, and I understand the rules and stuff, and I'm sure it's the intent of the department to do that, but I may contemplate a potential amendment up on the floor to just make that clear that the department shall adopt a rule that provides a provision, or something along those lines, provide some statutory guidance, just that people's personal, private information.
Senator Craigo?
Mr. Chairman, when we were talking about this in committee over the interim, not all of this is personal and private information. Some of it has to do with other things that are maybe in the case file, but not necessarily personal. And so I don't know, I'm happy to talk to you and we can work with the director on exactly what that would look like. I agree with you, but not all of it. And the problem is we can't share anything right now. And that's what we're trying to get at, is so that we can actually use this information to create a better system for our kids. But
Yeah, like the example of the community providers, I mean, the department would be possibly sharing their name and maybe a small excerpt of what their case is about. Then they would get a phone call saying, hey, do you want services? That's probably the most predominant way that it's going to be used, honestly. And I don't know that that's terribly confidential information that's being shared, but I do appreciate your concern and I don't know that I would have an issue with an amendment that had an opt-out
Yeah,
clause.
only in those specific cases, but, and by all means, I remember working on this years ago on judiciary. It's, the intent's good and we need to make sure that we can facilitate this. I just want to make sure that we're not taking away somebody's rights by providing information that they would like withheld.
Okay. Senator Kolb?
Thank you, Mr. Chairman. Director, I would assume, and I guess this is
Well,
the
we're not
que-
in public comment, Senator Kolb.
Oh, we're not.
No,
Oh,
we're working the bill.
Well, that's what happens when Senator Cole's late.
You can ask me a question.
But I can ask the question then.
And then I might punt it to the director.
All right, Chairman. The question I have is, this information, when it doesn't have to be specific towards any individual, would just be stripped of the identifying information as they're talking about it. And so I would assume that is what's going to be drafted as rules, that when, if it's not necessary, that they have this associated information that identifies an individual, because this will identify the effectiveness of programs. I don't know if that needs anybody's name attached to it.
Yeah, Senator Kolb, you're spot on. If it's for research purposes and they're sharing between departments, they're just trying to figure out how many people used X program, for example, it would just be a number shared and all the de-identified so that none of the data personal to them was transferred. That's the idea anyway. Other questions? No, thank you, Director. All right. Please do a roll call vote on Senate File 157.
Senator Craigo,
Aye.
Senator Crump,
Aye.
Senator Hicks,
Aye.
Senator Kolb,
Aye.
Chairman Olson.
Aye.
5 ayes.
All right, thank you, committee. The next bill for our consideration is Senate File 160, Treatment Courts Amendments 2. This is also my bill. This bill was a product of the Mental Health Behavioral Task Force, made its way, just like the last bill, to Joint Judiciary. This bill went to committee on the House side this session and failed by 1 vote. So the parties that were involved in this legislation, the courts in particular, but also others that were involved, stressed the significance of this bill to me and the co-sponsors, and we decided that it was worth bringing this bill back and trying to move it through the process with the hope that with education about the bill and what it really does and how it works, that we'll be able to successfully move this bill through the process. What it does is it allows for the creation of mental health diversion programs. Currently, there's 1 pilot program, I believe, and that's in Campbell County. 2 more are in the process of coming on board in Natrona County and Laramie County. The goal is to identify individuals who have made contact with law enforcement because of a mental health condition. That's the underlying condition that caused the behavior, whatever it may have been, that resulted in contact with law enforcement. And the goal is to divert them into a treatment court instead of sending them to jail where they will receive mental health treatment. The goal obviously is to reduce recidivism, but also to reduce the population of people who would be sent, for example, to our state hospital. Couple key things. The bill, well, actually a few more things about the bill, because that's the main thing that it does, but it has a few subparts to it as well. One is just an update to language. So that's part of what actually makes this bill so lengthy, is that the term in statute substance abuse is replaced with a more modern terminology, which is substance use disorder. So that really takes place on the back half of the bill. I don't remember where it starts, maybe page 13-ish, it looks like. Yeah, I think it starts on page 13, maybe, starts as early as page 10. But it starts basically from page 13 on, that's all it is existing language with the addition of, or the change to substance use disorder. So that's the second thing that the bill does. A third thing that this bill does is it allows for current drug treatment courts to take individuals from other counties, from other jurisdictions. There is no appropriation, so it's absorbed by the entities who are involved already, which would be our courts. And that is the bill. I would invite Ms. Butler up from the courts to provide any other information about this bill that I didn't cover and help me with questions.
Mr. Chairman, members of the committee, my name is Elisa Butler. I'm the State Court Administrator for the Wyoming Judicial Branch. I think the only thing that I would add is, as Chairman Olson stated, one of the changes to the bill allows for treatment courts, I believe, to take participants from other counties. There are a few other changes like that. When we took over the treatment courts on July 1st, one of the things that we had done to prepare for that was we met with a number of stakeholders who participate in treatment courts across the state to try to determine if there were other changes that were needed either by rule or by statute that it could improve their processes in each of those courts. And so there are a few changes throughout the bill that were requested by those stakeholders. So, Mr. Chairman, I would be happy to point those out, or I'd be happy to stand for questions or whatever your direction may be.
Yeah, if you don't mind, point those out to us real quick.
Sure. So, Mr. Chairman, you'll find the first change to that effect on page 2, where you find the definition of applicant, and that allows one or more governing bodies or 501c3s to create a treatment court in coordination with one another. So previously it was just a singular entity. Now it can be one or more, so it allows them to agree to create a treatment court. Let's see. The next one you will find on, let me just see, page 6, lines 16 and 17. So this is one of the goals of treatment courts, and this language was already in there. And again, these are the ones that are from stakeholders that were requested. And so that's used to say to strive for sobriety of participants. One of the things that we've heard is sobriety is not always possible. We're looking for improvement most of the time. So looking for recovery and mental wellness of participants. We have a few cleanup amendments along the way as well. And then on page 9, lines 8 through 9, this is the one that allows for a program to accept participants from any other jurisdiction in the state, so across county lines. One of the locations that we heard that this happens pretty frequently is between Lincoln County and Teton County, because those are so close together and the communities are so close together. You could have somebody in Lincoln County who wants to participate in the Teton County Treatment Court and is unable to do that currently. And then the Teton County Treatment Court would have to consent to that, so it wouldn't be a requirement. And Mr. Chairman, I think the last maybe big one that this committee that may bring up questions either with this committee or with other legislators is on page 11, lines 15 through 19. And this allows the Public Defender's Office to participate in treatment courts. This was actually a request from the Public Defender's Office. One of the concerns of that office was that their insurance could not extend if they actually wanted to participate in treatment courts, if their public defenders wanted to participate in that. And so this statutory authorization essentially protects the office and allows their public defenders to participate in treatment courts when necessary or when they're permitted to do so. So, Mr. Chairman, the rest of them, as you said, really do create more efficiency in the treatment courts by allowing the treatment courts to expand to encompass mental health diversion using the same resources that currently exist. So not adding resources currently, but using those treatment courts to provide that extra service. And Mr. Chairman, with that, I'd be happy to answer any other questions.
Committee? Yes, Senator Hicks.
Mr. Chairman, I just thinking back to the days of the number of times that we've redone Title 25, but it seems to me that many of those people that are captured under Title 25 would be eligible for this type of thing. And having sit through all the discussions, it boggles my mind that if we know that we're expanding this into that population, that there's no fiscal note associated with this. And so do you have any estimates when we expand this now from substance abuse now to mental health, what that potentially, because we know the number of people out there already under Title 25, those numbers. So how many of those do you think would be eligible to move into these diversion programs? If you have any idea on the numbers, and then why no cost, knowing that this is going to expand the cost associated with implementing the program?
Ms. Butler?
Mr. Chairman, Senator Hicks, I don't have those numbers. I don't know those numbers off the top of my head. What I would say is there are some qualifiers. So not everybody who goes through the Title 25 process
agree
would
with that.
qualify, right? They have to have committed or have had some kind of law enforcement encounter. And they have to be diagnosed with, according to our rules currently, a specific set of diagnosable mental illnesses. So it's not all encompassing. I think currently, because we are still in the early stages, we don't have a good handle on what that could look like. But what I would say is the potential of saving money in the long term is high if it's successful. And I think I saw Director Johansson here in the room, and he could probably give you some numbers in terms of the amount that is spent on things like the state hospital, that hopefully a program like this could divert people away from eventually having to enter that Title 25 process. So they get treatment early before they have to be titled, and are able to be, successful members of society and contributing members prior to the time that they're titled or have to go through any kind of evaluation or commitment at the state hospital. So I can't tell you the specific numbers. I think as we move forward with this project, we may have a better idea of that. But as of today, I just don't know.
All right. Maybe Director Johansson's testimony might help
I'll
elucidate some
wait,
of that.
Mr. Chairman,
Okay,
because I know it's going to cost something.
all right. Any other questions for Ms. Butler? Senator Kolb?
Yeah, thank you, Mr. Chairman. Ms. Butler, on the language change here that from substance abuse assessment to the new language, are we going to run afoul of CMS or any billing issues? Or are we creating a problem here? Because it came up years ago on language changes, because it has to be really specific towards being able to get reimbursement in some cases. Do you have an opinion about that, or a thought of this language change and why we need to do it? Thank you, Mr. Chairman.
Ms. Butler?
Mr. Chairman, Senator Kolb, I have no opinion and no knowledge about whether or not that could create any issues. But we did work with providers and, again, the Department of Health as we worked on this through this bill. So I anticipate the answer is no, but again, I think you have some other people in the room who may be able to answer that question better than I.
All right. Thank you, Ms. Butler. Director Johansson, you want to go next? So it sounds like we might get some of our questions answered by your testimony.
Thank you, Mr. Chairman, members of the committee, Stephen Johansson, Director for the Wyoming Department of Health. Ms. Butler did a good job going over the bill. If I may, Mr. Chairman, address Senator Hicks and Senator Kolb's questions. It's a good question on if you're diverting people into services outside of the jails or outside of the state hospital commitment process, what does that cost? And there is a cost there. I think going back to the discussion on the previous bill, where these parallel tracks from the legislature intersect, in this case with diversion courts potentially being set up, is with our behavioral health redesign that the legislature directed that was implemented July 1st of last year. What that did was prioritize the current appropriation and the current way the Department of Health procures and pays for mental health and substance abuse services to priority populations, including acute psychiatric adults, so Title 25, criminal justice involved adults, so Title 7, which this bill deals with, folks with mental health issues who have been alleged to or arrested or committed a crime, high needs children and their families. So on the previous bill, DFS or DFS adjacent kids and their families, and then a more of a broad category with low income, under 200% of the poverty level individuals with mental health or higher mental health needs. So in essence, Senator Hicks, what we believe can happen for jurisdictions that want to establish a diversion court, like we've seen on a pilot project in Campbell County, or now starting in Laramie County and Natrona County, is that the Department of Health, through its current appropriations and contracts with these providers, can direct those providers to provide treatment and services for these folks that would be diverted away from the Title VII criminal forensic commitment process. We all believe, the stakeholders that are involved, that that is not only good for me and the Department of Health, potentially reducing demand and capacity issues at the Wyoming State Hospital, which law enforcement and the courts will tell you is a problem. Our wait list at the hospital is too long. Our wait times are too long. We all understand that. Also reduce strain, stress, cost, and staffing issues at county detention centers who are holding and trying to care for these detainees while they await admission to the state hospital. And most importantly, for the individuals involved, folks who might benefit from more rapid access to treatment and stabilization as opposed to a long legal process to get evaluated, get treated by the state hospital, and returned back to the judicial system. So Senator Hicks, a long-winded explanation that I think we have the authority and the resources already from the legislature to prioritize these populations and provide access to communities who have a diversion court to have a willing and ready provider on hand, assuming that provider would agree. This is an additional duty, but the people who would go through this diversion would already qualify as a priority population for services under the behavioral health redesign. Mr. Chairman, if I may address Senator Kolb's question about the definitions and what that does for any billing issues, whether with the federal government or the state payment programs, we don't foresee any issues there. It's really just updated terminology that's found in most diagnostic manuals now.
Any questions for the director? All right, looks like you covered it really well. Appreciate that. Any other state agencies wishing to testify on this bill? If not, I'll open it to general public comment. Commissioner Malm, and yeah, Sheriff, come on up. Welcome, Commissioner.
Good afternoon, Chairman Olson, Committee, Gunnar Malm, Laramie County Commissioner, and Treasurer of the Wyoming County Commissioners Association, here speaking on behalf and in support of this bill for the Wyoming County Commissioners Association. Next to me is Laramie County Sheriff Brian Kozak, and before I let him get into the actual facts and figures, I just wanted to let you know, as a county official, why we believe this is such an important piece of the pie when it comes to not only mental health, but the gains that we've made with the move from treatment courts from Department of Health to the Supreme Court. Our jails have quickly become mental health housing units instead of places of incarceration for those that have committed crimes. And I'll tell you firsthand from going and touring our facility to see folks that are sitting there waiting up to 8 months to go to the state hospital to get an evaluation for a misdemeanor crime that likely they've already served their time for is quite troubling. The conditions of which they live because of safety are not conducive to any type of rehabilitation or any type of mental health support. And so this would allow us the tool to get these folks to the resources that they need, and also as a cost savings to not only local government, but the state of Wyoming in the end, because we're freeing up and just redirecting resources. We're not creating a new government. We're not expanding government. We're redirecting resources to where they're needed most in a fiscally conservative way that is also the most humane solution to a problem that every single county is facing. And so with that, I'd be happy to answer any questions or turn it over to the sheriff.
Committee. Thank you, Commissioner. Sheriff Kozak, welcome.
Thank you, Mr. Chairman and senators. So I just wanted to give you a little bit of stats currently with our jail. In 2023, 38% of our jail population was diagnosed with mental health disorder. In 2024, that number raised to 45% of our inmates. So today, right today in our jail, we have 78 inmates who are diagnosed with mental illness that are receiving medication and counseling within our facility. We have 20 additional inmates who are considered seriously mentally ill. We have 55 inmates who have previously been treated for mental illness or are currently being treated for substance use disorder. And we have only 30 in custody that have no history of mental illness and are currently stable. So that's a total of 183 inmates currently in our jail. Last year, we spent $3.9 million on medical services within the jail. That includes 5 master-level mental health counselors, 2 psychiatric nurses, 2 PhDs that help us with mental illness treatment, and then we have 24/7 nursing coverage. We do this proactive treatment because we're trying to prevent suicides. So last year, we had 30 suicide attempts in our jail. And we're also trying to stabilize these people while they're in custody so that we can make the role of being a detention deputy much easier by dealing with people who are stabilized. We also the county invested just over $1 million to produce and make a mental health pod, which we're getting close to open, so that we can better manage people who are in mental crisis. So just to give you an example, in 2023, there was a woman who was booked in our facility that was arrested for jaywalking, walking in the street, and then interference with a police officer. She spent 559 days in our jail before she was transferred to the state hospital. So these are some numbers, some examples of where the treatment court would help us to get some of these people out of the jail and into treatment. Currently, today, our mental health counselors have assessed our inmates, and there are at least 40 inmates who would qualify for this treatment court. And potentially, we could get these people out of jail and into the proper environment. And with that, I'll answer any questions. Thank you.
Senator Hicks.
Yeah, Mr. Chairman, so thank you, Sheriff Kozak, for those. If you looked at across the state, obviously you guys in proximity to a large municipal and being the largest municipality in the state of Wyoming with the highest population, 20% right here in Laramie County, do you see proportional type of incidents all the way across the counties? In other words, you said 45% of your occupants. Is that pretty consistent, or does it vary greatly from county to county as far as, and I'm just looking at percentage, not total numbers.
Sheriff Kozak.
Yes, Mr. Chairman, Senator Hicks. So we just started keeping track in 2023, and I do not know of any other jails keeping as good a data that we do now. Across the border into Colorado, the 45% that we have is much higher than what Colorado is reporting. So they're reporting an average of about 30%.
Follow up?
So you talked about the jaywalking, but is there any trends that you see that, and it gets back to the mental health and the substance abuse, are those pretty closely linked based on your experience with the people that you've got incarcerated or have been dealing with these issues? So they're interrelated, interdependent type of action, or they tend to be completely separate? Mental health versus substance abuse.
Sheriff Kozak.
Yes, Mr. Chairman, Senator Hicks, you're exactly right. Usually most of these people are diagnosed with both types of issues. And which one came first, it's hard to tell. But usually our counselors within the jail have to treat both sides of that issue.
So, and Mr. Chairman, I'm assuming that's the rationale to expand this to mental health plus substance abuse versus what we currently have. All right, thank you.
Any other questions for either the commissioner or the sheriff? Senator Kolb.
Thank you, Mr. Chairman. I don't know who would like to answer this, but the expansion at your jail, is that gonna be a Title 25 facility, able to handle those types of folks classified as Title 25?
Sheriff Kozak.
So I'm not sure I understood your question.
Okay, you've got folks that get titled under Title 25, right? And then they're hazard, danger to themselves or others, and typically they might go to a hospital with a Title 25 beds. Again, my question is, are these beds or whatever we're getting, it's cells, but are they gonna be capable of taking in people that are titled under Title 25?
Okay, yes, Mr. Chairman. So, again, to qualify for the treatment court, they have to meet certain parameters, and usually it would be nonviolence, misdemeanor type of offenses. So a lot of times with the Title 25s, we do try to transfer to the hospital. A lot of times we get these people back into the jail because then they've assaulted hospital staff, committed a violent crime, and then we wind up with them in the jail.
Follow-up question.
Go ahead.
So overall, because it sounds like, you're in favor of moving forward with this type of a change in legislation, you believe then it's going to be a cost savings to you and the county to go down this road, to take this policy without any other impacts to the state? You believe you can handle it, basically, it's a win for you fiscally? Thank you, Mr. Chairman.
Oh, I'm sorry. Sheriff Kozak?
Yes, sir, Mr. Chairman. Senator, yes, I do support this for the reason because right now, sometimes we have just a revolving jail door. People are coming in and out of our facility. So hopefully we can, with a program like this, where there's constant monitoring through the court and also through your providers in the community, we can keep people from coming back to jail.
Mr. Chairman, if I can just briefly address it as well. Yes, the commissioners certainly believe and have invested the money in the mental health pod as well because of the liability that surrounds all of this for counties and for government. The sheriff mentioned 30 attempted suicides in a year, and despite governmental immunity, in a lot of cases, those kinds of things can rise to the level of lawsuits that can be very costly for local government. And so aside from the humanitarian component of, yes, wanting to take care of these people the best we possibly can, we also are trying to protect all residents from the increased costs that could come from any sort of incident that would happen within the facility or in the community.
Very good. All right, thank you, Commissioner. Thank you, Sheriff. Oh, you got something else you want to share? Go ahead.
Mr. Chairman, just one more point, if I may. I'd just like to offer to any member of the committee or the Senate as a whole, you're welcome to contact me and tour our facility, and you can see the problem firsthand. Thank you.
Thank you for that invitation. Any other testimony? Please come forward if you're wishing to testify and fill up the chairs. That way I know how much time we have. Go ahead. Welcome.
Mr. Chairman, Andy Somerville again with WAMSAC. And Mr. Chairman and committee members, my comments will be again very brief. Representing the community mental health centers, they provide these services under behavioral health redesign. We are very supportive of this bill. Again, it gets at I think the core mission which we've been given under behavioral health redesign, which is to divert and try to identify those populations, try to keep them out of the state hospitals, all of those pieces. Would also echo that this type of program is one of the most requested we hear from our community stakeholders. So my community mental health centers are constantly getting asked by county commissioners or sheriffs or others, hey, can you help us out? Can you do this? And right now, we try to provide services the best we can in those areas, but I think legislation along those lines, this line is going to help that significantly. The other piece that I would just share with the committee as an example, so it doesn't pertain to this legislation, but there is a municipal mental health diversion pilot going on in Natrona County right now, so it's just for the municipal court, done with the city. They've already identified in the last few months 83 participants that they were able to pull in and divert into mental health services to help relieve some of that burden and hopefully get those people intervention services that will help end that cycle. So again, as providers, they're all very supportive, and we would ask for support with the bill, and I'm happy to stand for questions.
Any questions for Ms. Somerville? Thank you. Welcome.
Thank you, Mr. Chairman. My name is Alan Thompson, the Executive Director of WASCOP, the Wyoming Association of Sheriffs and Chiefs of Police. And I would just like to echo Sheriff Kozak and the other people that have testified this morning and add, there was a question earlier about whether the data collected in Laramie County mirrors the data that we see across the state. And we don't have a robust collection center for that data from all 23 jails. But in conversations with them, where that data is not tracked, it would appear that that number is a little bit low. But I would also suggest that there's probably not another county in the state, say one or two, that have such a robust mental health, especially, and medical program as described by the good sheriff here. And I would like to also add that our organization, WASCOP, is supporting efforts to expand education on this point, and even some peripheral grant opportunities that might help in the substance use section of things, but could have some bleed over and help support this effort going on. And then I'd just like to finally add that we think this saves money in the long run, so long as community level mental health services outside of the jail continue to be funded in the future. And I'd stand for any questions, Mr. Chairman.
Fantastic. Any questions for Mr. Thompson? All right, thank you. Appreciate that. Any other public comment online? All right, with that, I will close public comment. Committee, what is your pleasure?
Move the bill.
It's been moved by Senator Kolb. I do have 2 amendments to this bill that were shared with me by the courts in trying to address some of the concerns from the other body across the hall. The first amendment takes place on page 5. Lines 13 and 14 provides us a definition of mental illness. That's pretty expansive. The amendment would be to narrow that and tighten it up. It would be to strike on line 13 means as defined by WS, strike on 14 remainder of the balance of the sentence, and insert is limited to schizophrenia, comma, schizoaffective disorder, comma, major depressive disorder, comma, PTSD, comma, or bipolar disorder, comma, as diagnosed by a mental health professional. Any discussion? I already gave it, but Senator Craigo?
So, Mr. Chairman, so we're saying in diagnoses is required prior to us using the diversion program that we're trying to set up. Is that what that language does? I mean, the end of it says as diagnosed by.
Well, we'd have to look at the statute 351613 and see if it's already a requirement under statute. Do you know, Ms. Butler? If it's, or we're searching statutes.
Mr. Chairman, so the definition in 351613 of mental illness is mental illness means a condition which is manifested by a disorder or disturbance in behavior, feeling, thinking, or judgment to such an extent that care and treatment are required, but does not include addiction to drugs or alcohol, drug or alcohol intoxication, or developmental disabilities.
So to answer your question, yes, Senator Craigo. It does 2 things, it looks like. It requires an actual diagnosis by a mental health professional, and then it narrows the type of disorder that a person can be diagnosed with. I think the idea of the amendment is to try and maybe this is something that we work with as the treatment courts go into effect and we see how they work, but I believe the intent was literally to narrow the scope of who would be admitted. Senator Crum?
Mr. Chairman, with diagnosis being needed, how long does that take in the process? Because the goal is to get the person the treatment as quick as they could, I would imagine. So how long does it take to get a person diagnosed?
I think in my experience with like Title 25, for example, it's pretty instantaneous. When you're in the hospital, you're getting treatment, you're diagnosed before you're probably within 24 hours, your team is diagnosing you, would be my guess, but I don't have a lot of experience with it. Senator Kolb?
I think to that question is they make a determination if you're to be titled or not at the hospital and at an emergency hearing with the judge. I don't know if they make a determination to I guess the actual, that's just a state of being to danger to yourself or others as they determined by the court. I think the mental health professionals in the community would have to come over and then do an evaluation, and that's a good question. That was kind of my question too, is how quick would that happen? Thank you, Mr. Chairman.
Ms. Butler, do you have any input?
Mr. Chairman, the way that the process is working right now is generally when there is an encounter with someone who either law enforcement or the judge or an attorney believes is qualified for this program, there will be a determination by the judge whether or not the person should enter, and then they'll do a quick screening either at the jail or, as you heard from Director Johansson and Ms. Somerville, one of the community mental health providers may come in and do a quick screening to see if they qualify, and then there will be a more substantial screening of mental health screening of the individual to diagnose them with whatever mental illness they may have. And I can tell you, I believe, to Chairman Olson's point, this really was an attempt to narrow down and try to alleviate some of the concerns around who would qualify for these kinds of programs.
Senator Craigo?
And just one quick question. I mean, as we're looking at this, I mean, part of the point of the diversion is to catch people before things get too serious. And the list that the court's provided to us seem to be on the more serious end of the mental health problem. Are we paring it down too much, or or is it going to actually be able to serve its purpose if we're not able to catch the folks that need the help on the front end versus are we too far gone, I guess is my question.
Ms. Butler?
Mr. Chairman, Senator Craigo, I think from our perspective, obviously, we'd like to catch as many people as we possibly can. I do want to be mindful of the fact that we want to make sure that we're addressing some of the concerns that have come out previously. I would say when in Campbell County, I think they are looking primarily at these mental illnesses, and then if the treatment court team determines that, somebody else should come in, then they can. But at this point, those are the primary mental illnesses that they're focused on.
Okay, thank you, Ms. Butler. Any other discussion on this amendment? You guys ready to vote? All those in favor signify by saying aye.
Aye.
Any opposed?
No.
All right, that amendment does carry. Any other amendments to this bill? All right, any discussion on this bill? All right, Pierre, will you do a roll call vote on Senate File 160, please?
Senator Craigo,
Aye.
Senator Crum,
Aye.
Senator Hicks,
Aye.
Senator Kolb,
Aye.
Chairman Olson,
Aye.
5 ayes.
All right. The next bill for our consideration is Senate File 124, Illegal Immigration, Identify, Report, Detain, and Deport. Senator Steinmetz.
Thank you, Mr. Chairman. Senator Sherry Steinmetz, Senate District 3. Did I get everyone a tracked-in copy? Did I get you one, Senator Crum? We have a large amendment that I want to make sure. Does everybody have a tracked-in copy? All right, Mr. Chairman, so I would be glad to take you through the bill. The history on this is for several years, we've been working as the Wyoming Senate to address the issue of illegal immigration. 1 year in the budget, we had $5 million for the border wall. We know the governor has been trading local law enforcement to go back and forth and help with border control. And so I was surprised to see when I looked in our statutes, we had nothing regarding illegal immigration in statute. And so with that, I did find a bill from 2009 that Representative Illaway had written. And so that is kind of where the starting point happened with this bill. Again, this bill doesn't do anything to people who are here legally. It's just designed to deal with illegal immigration. And so after you go through the title on page 1, there you will see on page 2 that is part of the amendment. We're providing for an appropriation to help with this effort with our local law enforcement. So first on page 2, we deal with transportation and concealment of an illegal alien and make it so that no one should be transporting or moving them into the state of Wyoming knowingly. or concealing or harboring or sheltering someone from detection. Then onto the next page, that shows the violation for that of not more than 5 years or a fine not more than $5,000. Next, moving on to line 10, that we would delete that with the amendment 10 through 13 and insert subsection A where subsection B was, and at the end of the sentence, add upon a peace officer's reasonable articulable suspicion of a person's immigration status. So they have to have a reason for that. The Sheriff's Association and the county commissioners have been extremely helpful in recommending amendments to this bill. Then we create a new subsection B. The sheriff shall investigate the immigration status or lawful presence in the United States of any person who is arrested and booked into jail. And so that's when they do the investigation of that. And then subsection C continues on. If they determine that a person is an unauthorized alien, then they shall notify the United States Department of Homeland Security or the United States Immigration and Customs Enforcement. Upon providing that notice under this subsection, the sheriff shall continue to detain the person in accordance with the law. Then that's where you get into the new subsection D about continuing to hold the person in accordance with the law and the signed agreements with the United States Department of Homeland Security or Immigration, ICE, basically. Then we go on into page 4 and at the bottom of the definitions, what a federal public benefit is, what local government means, that's pretty standard, more definitions of state and local public benefit, unauthorized alien, and then the employer verification, which we pretty much do already. We have to have an I-9 form, but they could also use the E-Verify, but if they discover somehow that someone's here illegally, then they would report that to the federal law enforcement or state and local law enforcement if authorized, and that's another portion of the amendment. Then you go into the violations and penalties there. That's just was standard in the other bill that I worked with. On to page 7, it deals with public benefits. It just shows that except as provided by federal law, we shall verify lawful presence for in order to receive benefits. So that is for bottom of page 7, any purpose if lawful presence in the United States is not restricted by law. And so assistance for healthcare items and services that are necessary for medical treatment if items or services are not related to an organ transplant procedure, short-term non-cash in-kind emergency disaster relief, public health assistance for immunizations. So those things are the ones that are not required, but then when you go into the other ones that are program services that provide in-kind services at the community level, including private and nonprofits. So basically that just goes into the public assistance and how you verify that. And then on the next page, we took out all the language of the affidavit for verification and just used how the identification we use for voting. And so that is your driver's license, tribal ID, Wyoming ID card, passport, military card, driver's license, all of those things that are valid for you to be here and receive benefits. And then the next on page 10 makes necessary revisions regarding the affidavit. Subsection G is allowing the local agency or the local government to adopt variations of these requirements. So if they don't want to be quite as strict or they find a more efficient way to do that, then they can do that on at the local level. On page 11, that just is about the Attorney General and other agencies entering into agreements with the federal government so that they can utilize the alien verification entitlement program system to make sure that we're in compliance with that federally. And then the next part is where on page 12, the Attorney General can enter into MOUs. And then also each county sheriff on subsection C, each county sheriff in consultation with the Board of County Commissioners may, and that's a change from shall to may, negotiate terms of the MOU between the county and the United States Department of Justice and the United States Department of Homeland Security for immigration laws. So basically that the rest of the section deals with that, and I don't want to take up all of your time because I know there are people here with testimony, and so I'm trying to speed through this. And since I gave you the bill early, I was hoping you had a time to read it, but.
Yeah, you're doing a good job. We did all receive this.
All right, so I'm going to skip on to page 15 where we have a lot of language that's stricken, and that's regarding prisoners because we're dealing with that on the front end, where when they actually arrest the criminal, then they deal with that on the front end. So basically, they know who's in the jail already. They don't really need to do that again. So we're deleting on 15 and 16 the stricken sections. And then the last part just deals with obtaining a driver's license or permit. And so it just outlines how you do that, and we make sure that people are actually legally here, how we deal with the temporary permits, all of that. So with that, Mr. Chairman, I would, oh, and there's one more amendment on the back on page 19. We insert the language of the appropriation. It's a $1 million appropriation for unanticipated expenses. It's a reimbursement basis, so they're not just getting a chunk of money. And then it also allows for anti-terrorism training because we know that there are concerns that we've had some terrorists enter the country illegally, and so we want our local law enforcement to have the ability to be prepared if they aren't already. So that's what the bill does. I'm sorry for it being so quick, but we're coming to the end of time for getting bills out of committee, so I want to be sensitive to your time, and with that, I'd stand for questions.
Thank you, Senator Steinmetz. Any questions, committee?
Mr. Chairman,
Senator Hicks.
so much of the bill deals with county sheriffs, and I understand they tend to be the jailers and stuff. But there's a couple places in here that even so municipal law enforcement may or may not be included in this, and I just wonder, and even when we get back to the anti-terrorism training that specifies, I believe, for sheriff's department, was it the intent to have certain duties for municipal law enforcement in addition to sheriffs, and then other places it's just sheriffs? Was that purposeful to do that, or just an oversight to not include all local law enforcement?
Senator Steinmetz.
Mr. Chairman, Senator Hicks, that might have been an oversight. Again, we did work with the association that represents both. And so if they have other suggested amendments for a true up, I'd be more than happy to consider that.
I just want to clarify this for the record because I think this is an important change that you have in your amendment. On page 3, under the statute here that would have been created, 7-2-109, this provision I've heard a lot of response to. It was very controversial, so I appreciate you taking it out. But this provision would have said that anytime a person is detained or cited or arrested, that law enforcement would have to make a finding that they are in fact a U.S. citizen. And that is, your proposal is to remove that language from the bill.
Correct, Mr. Chairman. That is the proposed amendment that I've offered to you.
Very good. Other questions for Senator Steinmetz? Senator Crago?
Thank you, Mr. Chairman. So, and maybe we can get some help from the law enforcement guys, but what exactly in your mind is going to constitute reasonable, articulable suspicion of a person's immigration status?
Thank you,
Senator Steinmetz?
Mr. Chairman and Senator Crago. I will let I will have to phone a friend on that because that is their language, and I would ask them to comment on that.
Okay, we can, yeah, we'll hold that question.
And Mr. Chairman, so turning to the appropriation, good Senator.
Yes.
So the way I read it is we're reimbursing counties in the proportion to the population of that their county bears to the total state population. That's the language within. So what if one county, I mean, is that really a reimbursement, I guess is my question, because I think there are particular counties that will have much higher expenses than other counties, but they're going to be limited by their population. Is that how I'm reading that?
Senator Steinmetz?
Thank you, Mr. Chairman. It was my understanding that it's the population of the inmates that they're holding, but if that's unclear, then we could change that. It was, the population of the people that they're dealing with.
Senator Craigo?
Thank you, Mr. Chairman. Yeah, that's what I thought the intent probably was, just in talking to you a little bit about it, but I don't actually think that's what it says, so we might have to work on that.
Mr. Chairman, Senator Craigo, I appreciate your guidance on that. Thank you.
Very good. Other questions for Senator Steinmetz? All right, thank you. State agencies. Do we have any state agencies wishing to testify on this bill? Department of Transportation, welcome.
Chairman Olson, members of the committee, my name is Misty Zimmerman. I am the program manager for Wyoming Driver Services. I just wanted to address a couple things in this bill specific with the application for the driver license and identification card, which starts on page 16 of this bill. A little bit of background, back in the 2009-2010 sessions, Wyoming legislature decided that Wyoming would only issue Real ID compliant cards, whether that's a driver license or an identification card. And so since that point, beginning October of 2011, Wyoming began issuing Real ID compliant cards to all citizens. The requirement for a Real ID compliant card means that a person must prove their legal identity, they must prove their physical residence within the state, proof of Social Security, and proof of lawful presence. So the statute clearly identifies under 31-7-111 those things that are outlined in most of the information that's included in this bill, and we have been following this since 2011. So I'm not exactly sure what we're trying to do as we identify this, as we've been following the Real ID Act of 2005 since that time. And we are currently following these procedures and that are also very much and very similar to the Real ID Act. So just made mention of that we are currently doing this. Everything that's in this addition to this statute is being completed.
The list that you just read off did not require you to make a finding that the person is a United States citizen. Or what part of the information that you currently collect do you think satisfies that question?
Chairman Olson, proof of lawful status. So if you
you did say that.
Yeah.
I'm sorry.
Yeah. So as we walk through this bill, everything that we're seeing here, we're currently doing and is in statute. There are some additions that we maybe could do some amendments to clean up and tighten up our existing statute. But I feel that as a department, we're complying with this new statute or the addition to the statute at this time. With that, I'll stand for any questions.
Any other questions, committee, for the Department of Transportation? Yes, Senator Craigo?
Thank you, Mr. Chairman. So the language that essentially what you're saying, or how I'm taking it, is we're just repeating language that is already in statute somewhere? Am I following you?
Chairman Olson and Senator Craigo, the exact verbiage is not in statute. However, the requirement to follow the Real ID Act is in statute, and most of this language is taken directly from the
federal law.
Mr. Chairman,
Senator Crum.
just so I'm clear on this, when you say most of it's in there, can you tell me like page 6, all of page 16, 7? Just can you tell me where that's at for sure? Thank you.
Chairman Olson, Senator Crum, I pulled this and I can go and provide this to the committee, but this is the definition out of the Real ID Act for lawful status. A person of lawful status is a citizen or a national of the United States or an alien lawfully admitted for permanent or temporary residence in the United States with conditional permanent resident status in the United States who has an approved application for asylum, has entered into the United States in refugee status, who is in a valid non-immigration status. So all of the information from the Real ID Act, which is both for lawful status and temporary lawful status, is included in the Real ID Act, which is federal law. Excuse me. I can provide the committee with a copy of this if necessary.
So amendment-wise, from our standpoint on the bill, are you suggesting that we just don't need the statute 317111's changes, which would be everything on page 16 and 17 and 18? Yeah, all of 17, all of 18, and the bottom of 16?
Chairman Olson, in addition to that, I would recommend the portion for the identification cards on page 19.
318101 subsection B?
Correct.
Okay. All right. Other questions, committee? Yes, Senator Hicks?
Yeah, I'm gonna, Mr. Chairman, pick up where Senator Crum left off when I go through these, and so it's not so much going through and telling me. So you said most of these are already in statute. Explicitly, which ones are not, is I guess the question I'd like to know.
Okay.
Chairman Olson, Senator Hicks. The portion where it talks about what is required to be on a temporary license, which is the immigrant licenses, is actually contained in our rule versus statute. In addition, I would also maybe propose an amendment that we would require the verification through the United States USCIS SAVE verification system for all permanent resident or all driver's license issued to non-US citizens.
Where would you put that?
Chairman Olson, Senator Hicks, this portion of the statute is not included in this bill. Under 317111A, if we just add to the last sentence, the division shall use the system of electronic validation of a document and identity that as they become available or alternative method approved by law.
Mr. Chairman, that was a little fast for me to catch all of that.
You have it
I
written
can
down?
provide this to,
Oh, yeah, thank
That
you.
would be helpful.
okay.
Yep. Rather than us try to pencil it in really quickly. Okay. Any other questions, committee? All right, thank you for your testimony, very helpful. Any other agencies wishing to testify on this bill? Sheriff Kozak, were you planning on testifying on this? No? Okay. All right, so here's the deal. It is 1:10. We have to be back by 1:45. So I want to get a gauge of the room. First, let me know if you are planning on testifying on this bill. Just raise your hand. Okay, well, we can do that. And then, so there's about 4, 5, 6-ish people. And then online we have Pierre, about 9 people. So what I'll probably do is limit your testimony to 2 minutes. That way we can get through everybody. And I'll open to general public comment now. So anyone who wishes to testify, just please come forward. And please fill up the chairs so we can move a little expeditiously. Mr. Thompson, we'll start with you. Go ahead.
Mr. Chairman, I'm Alan Thompson with WASCOP, the Chiefs and Sheriffs Association. And the proposed amendments that were discussed by the good senator were all taken with our input that the function of immigration in Wyoming rests with the sheriffs and the jails at this point. And so this would codify the existing practices that are going on within the state. There wasn't an intention to remove police departments from that, but the function rests with the jails and detentions right now. So we were just trying to clarify that in statute. If you look at the amendment on page 3, line 17, that adds that upon officers' reasonable articulable suspicion of a person's immigration status. This was just our attempt to allow, we don't foresee what's going to happen with agreements with ICE or other federal entities from police departments. So there's already a function for sheriff's offices to have those agreements with people that are arrested and charged with a crime. But we don't want to limit the Wyoming statute for something that could happen in the future that opens that up to maybe a police agency receives some sort of certification to investigate immigration issues that is already allowed under some of the ICE agreements. But we would definitely be open to any suggested fixes that the committee might have. And Mr. Chairman, I would just say that our membership has supported the other amendments in here that try and move this to an existing practice that we have right now, while then recognizing that agreements may be forthcoming with ICE. And I'd stand for any questions, Mr. Chairman.
Senator Hicks.
What is articulatable mean in the context of this sentence?
Mr. Thompson.
Mr. Chairman, this is our attempt to make sure that we weren't doing or accused of doing racial profiling, which is a violation of standards in federal law. So basing it on a reasonable articulable suspicion, that is standard language that we hear in court rulings, that is that reasonable suspicion stage below the probable cause stage. It gives us the authority to extend a contact or a stop based on the belief that criminal activity is afoot. So we would definitely be open for better language for that, but we don't want the initial draft of this bill indicated that we ask everyone all the time on every contact, and I just don't think that that's sustainable nor warranted. And so how can we bridge that gap and make it realistic? And this was an attempt at that.
Senator Craigo.
Thank you, Mr. Chairman. So, Mr. Thompson, as amended, are you supportive of this bill? Does your organization support this legislation?
Mr. Thompson.
I would hesitate to say support, but this is heavily amended to where we can do everything, we believe we can do everything that's asked in this bill. So we can comply with everything that's asked in this bill.
All right, fair enough. Any other questions for Mr. Thompson? All right, thank you.
Thank you, Mr. Chairman.
Ma'am, you're up next.
Hi, Mr. Chairman. My name is Alexis Soto, and I just came up here to do like a public comment to share my story, if that's okay, about how this bill would like affect me and my family and my job and just the life that we live here in Cheyenne. So first, I just wanted to say that I work here in Cheyenne. I have 2 full-time jobs, one at a Title I middle school. I have 1 part-time job at a Mexican restaurant. And I've also been a volunteer with the Cheyenne Police Department for 4 years. I have a daughter who is also in a Title I school. She is in the ESL program with other children who came here while their parents were pregnant with them. And their parents are undocumented, but they were able to become a U.S. citizen because they were born here, to no fault of their own. I also work in middle school with students who have been scared for the past few weeks to even come into our school because they think that us teachers are going to turn them in to the police and say, oh, we're working with illegal students or illegal aliens, to no fault of their own. I pay taxes just like everyone that is supposed to do as an American citizen. But one thing that sets me out is that all of my family members are undocumented people. My parents came here and they were undocumented, and my mom was pregnant with me and she gave birth to me. But I wanted to set out to be someone that wants to stand up and do my civil duty. This is the first time that I've ever done anything like this. But I just wanted to share that doing this is sort of a way of racial profiling someone. If you're driving with someone and you look a different nationality and they pull you over and they say, oh, is anyone in your car an undocumented person? The wording in the bill says if you're caught transporting someone that you willingly know is undocumented, you could face 5 years in prison. So for me, how am I gonna be at risk to go to prison for working with students that I knowingly know are undocumented, but I can't share who they are due to FERPA, the federal law. How can I go to prison for being married to someone who is undocumented? How can my children's father go get taken from ICE and then I'll be put in prison because I knowingly know that he's undocumented, but we're through the process with immigration to try to get him his papers. But once you go through that process with immigration, it takes years and years and years. It could take up to 6 years to get approved for a work visa. And in those 6 years, you're still considered undocumented, even though you're trying to do things the right way, as people say. So I just come here today to say that this is just taking an ideology bill versus a policy bill and just taking it to the absolute extreme. And I just want to say that me as a teacher, me as a restaurant worker, me as someone that works with kids that are in special needs, that come here, their parents come here and bring them here for a better life, for better medical care. My daughter who has to grow up and see this world and be scared to say, oh, is my grandpa gonna get pulled over and go to jail? Oh, is my dad gonna get pulled over and go to jail? Is my aunt gonna get pulled over and go to jail? Can we even go to church on the way to church? Are we gonna get pulled over and one of us is gonna get taken to jail and then I'll be in trouble or face a fine of $5,000? So I just wanna come here to say that this bill is completely an ideological bill, and I
So I'll
just
have
hope
to
that.
have you wrap it up. You're over your 2 minutes.
And
I'll
I
let
just
go
hope
for a
that you
little
guys
bit.
could see my side of things, just as a community member born and raised in Cheyenne, Wyoming.
Thank you. Any questions, committee? All right, thank you for your testimony.
Thank you, Mr. Chairman.
You're up next.
Thank you, Mr. Chairman, members of the committee. I'm Josh Hannes with the Wyoming Hospital Association. I'll be very brief so that other people can have an opportunity to talk. As you all know, and I think it goes without saying that with state level bills such as this and what's happening at the federal level, there's a lot of uncertainty in terms of what hospitals and healthcare providers are going to be responsible for and what their duties are beyond caring for patients as it relates to this issue. So I just want to let the committee know that there is anxiety caused by that uncertainty and what's required of us. Specific to this bill, however, it's a comment and a little bit of a question on page 5 under employer verification of employees and reporting. It talks about contractors. And so hospitals will contract with a variety of firms to do IT work, construction, environmental services, any number of things. Does this bill place the requirement on us to audit all the people inside of that firm that may or may not be working on a project for our facilities? And, I would say some of these firms that we might contract with might have hundreds and thousands of employees. And to what degree are we then responsible for the auditing of those who may or may not be working on a project or doing a piece of work for us, either on site or not? So I'll leave my comments at that and stand for any questions.
Any questions, committee, for Mr. Hannes? All right, thank you. Deacon Lehman?
Thank you, Mr. Chairman. This 2 minutes is going to be rough, but we're going to see what we can do. My name is Mike Lehman. I represent the Catholic Diocese of Cheyenne. We believe that every nation has both a right and a responsibility to establish and maintain the integrity of its borders and uphold the rule of law. At the same time, we believe we must also uphold the dignity of those seeking to migrate, some of whom are fleeing from violence or oppression. This balance is best achieved at the congressional level, and I'm hopeful that our current Congress will achieve that. I think there's a reason why there's an absence in our current statute here in Wyoming for legislation dealing with this. I often speak about our foundational principle of human dignity, emphasizing the state cannot grant human dignity. It merely recognizes what's already there. Human dignity does not wait for government-issued documents to arrive in the mail before manifesting itself. Just being a living member of our species means it's already there. Mr. Chairman, because of time, I would just share that very often, whether we're talking about the preborn, or whether we're talking about the working poor or the migrant, these are often sort of the invisible populations. But there are Catholics, there are other Christian ministries throughout the state that minister to these vulnerable populations, not because we think they're Christian, but because we are. And there are many people around the state who are concerned that portions of this bill could potentially violate their ability to exercise their religious freedom. With that, Mr. Chairman, I don't know where I'm at on time, but I will stand for any questions.
You're right on the money.
Okay.
Any questions for Director or Deacon Lehman? Thank you.
Thank you.
Anyone else wishing to testify on this bill, please come forward, fill up the chairs. Senator Hutchings.
Thank you, Mr. Chairman. Senator Hutchings, Senate District 5 here in Cheyenne. Appreciate the ability to come in and stand on and for this bill. I look at this bill as a bill that will protect, and that when you're not doing anything wrong, in my eyes, you should have no fear of the law. We have allowed over the last few years our borders to be left wide open, and people from every nation in the world are here without being coming through and going through the right process. I feel for those people, like the young lady before me that said her family members came in undocumented, so on and so forth, but a wrong was done, and we have to try to right it. We have to try to fix what we've allowed to happen so far, and it will be messy. I think this bill is very reasonable. It's unfortunate that many of those who are involved with and will be questions may be inconvenienced, but to protect them and our state as a whole, I see that in my eyes, we have not had this type of law before because this type of thing hasn't happened at this magnitude. So with that, Mr. Chairman, just want to say I'm on and for the bill, and thank you for the opportunity to speak.
Thank you. Any questions for Senator Hutchings? All right, thank you for
Thank
your
you, sir.
testimony. Go ahead, ma'am.
Hi, my name is Maria Alvarado Duran. I, like Mrs. Soto, am a child of.
Is your microphone on?
I
Is
think
it green?
so. Yes.
Okay, go ahead.
Sorry. Like I said, like Mrs. Soto, I'm a child of immigrant parents. Wyoming has been my family's home since my parents came here in the 70s. I'm sure you guys have all statistically heard everything that immigrants, including undocumented immigrants, contribute to the economy as a whole. And unfortunately, I was unable to find anything that specifically represented Wyoming. But like she said, it is difficult to do things the right way unless you are basically rich in another country. So coming here illegally, unfortunately, sometimes is the only way for some of these people to do it. Immigrants as a whole contribute to 25% of businesses, creating businesses. So therefore, they're creating jobs, not so much of a strain to the community. But, sorry, I'm trying not to get emotional, but it's difficult to listen to everything and not become emotional when you're talking about this. But my biggest push on this is, just like Mrs. Soto's, being of immigrant parents, immigrant family, and working in healthcare, you hear the concern, the anxiety causing of when is this going to happen, and having backup plans to uproot your entire life when something like this happens. But the biggest point to this is I am a mother. Both my children were born here, and the idea that my children would be profiled, because I can safely say that my children do not look like any of your children. And we're giving the sheriffs, and not all of them, but we're giving them the opportunity to profile our families, our children. And like I said, my children are documented, but the idea that just because they're a little bit browner, they are subject to this harassment essentially is unnerving. So like I said, obviously, being a member of the community, I'm very, very opposed to the bill.
Thank you.
Thank you.
Ma'am, you're next.
My name is Dallas Higginbottom. I'm against this bill. This is a ridiculous bill, in my opinion. I want to know what it means to have suspicions. Is it a 78-year-old woman who just walked out of a gas station, who takes care of her disabled son, who was pulled over just because she looked brown. And you know what? She was. Now, on the means of being able to become legal, there are people here who work. That way they can. That way they can pay those debts to become legal. However, because this lawyer understood that this person was illegal, decided to take their money and cease all contact, leaving this person without citizenship and without the money that he worked so hard here in America to put forth into his citizenship. Now, if we are talking about giving people years sentencing of contracting, working with illegal or undocumented people, then be prepared to arrest almost half of Wyoming. There are many, many women, many husbands who have hired somebody who was illegal to have their pond done, to have their landscaping done, their roofing, their cleaning done. And because they knew that they were illegal, they ended up paying less than half of what those other people have, I guess, their regular dues. It's ridiculous, all because they are illegal, undocumented. This bill is pretty much allowing them to lawfully and allowing law enforcement to racially profile us. And I will stand against that. Thank you.
Thank you for your testimony. Ma'am?
I have never,
Is your mic on?
yes,
Start by introducing yourself, please.
my name is Mary Espinoza. We are all immigrants. Every one of you are immigrants. My family was immigrants. When did we start profiling? I married a Hispanic. Now I have to worry for my daughter to be turned to a profiling? My grandkids? You guys are all immigrants. We were fortunate. These people that want to stay are working. Go after the ones that are breaking the law. Just because they work hard, you guys are profiling? What happened to our country? What happened to the state of Wyoming? I came here 26, 27 years ago. This is not how I was brought up, to profile. I thought we were supposed to be equal, to help one another. Isn't that what we're supposed to do? If they're working, let them work. It doesn't hurt anybody. You're an immigrant. I feel like I've just never, ever in my whole life, I am 63 years old. This is not how it was supposed to be. Come on. Just because, what? Because they're working, they want to stay here, they contribute, they pay taxes. I see more white people getting help, not that we're supposed to be profiling, giving them free things when all the Hispanics are working. It's sad. I feel like all of a sudden we're white, we're privileged. That's not true. You know it. My husband's family has been here longer, if you look at it, because they're from New Mexico.
That's 2 minutes. Thank you.
I'm sorry.
Thank you. All right, you're next.
Hi, my name is Trinity Gamez. I just kind of want to throw out a few ideas I've got. The bill is not going to affect me personally. I'm an American citizen. I have that white privilege. Not going to hurt me. But there's a time and a place for everything. There needs to be a reform done federally. Absolutely agree. Whatever, however that happens, that's to the powers that be, way above my pay level. I moved to Wyoming 24 years ago from California. Would never go back. Couldn't pay me to go back because of what Wyoming was always to me. And till a few weeks ago, I thought still was. I am less government, fiscal responsibility, all of the values that I was always taught were the good things. I don't see a way of scaring kids. And I got some neighbors that are brown, got some that are lighter shade of brown, got some that are white. I don't know where any of them are from, nor do I care. One neighbor, Ohio, okay, I'm a Steelers fan, he's for the Bears. I care where he's from. Nobody else, I don't care. I'm not gonna ask. I don't think that I'd be offended if they asked me, but that's not their business anyways. So what is the reason for this? There's ICE, there's federal agents, that's their job. Their offices have been now tasked to apprehend more people, which is, hey, do what you gotta do. How does that fit into anyone stopping? I have 2 kids that are super light-skinned, and I've got one that's a little bit more brown. He's my biggest coconut. He's hot dogs and mac and cheese. But he'd be the one that got stopped because he looks like he might not be from here. But he is. That I have an issue with in Wyoming. Could see it in California, could see it in a lot of other places. But we just didn't do that here. So I kind of
There's the
think
2-minute
less
mark.
government's better.
Thank you. All right, so people keep coming up, even though I asked you to raise your hand, and only a couple of you raised your hand. So at this point, I'm gonna take your testimony, sir, in just a second. But what I'm going to do is I'm just gonna have to shift it to a for and against. So if there are no for testimonies, there are no against. If there are no against, there's no more for testimony. We'll do the same thing with our online testimony in order to try to get through everybody. Sir, you're next.
My name is Ted Espinoza, born in Laramie, Wyoming in 1953. We suffered from racism, vicious racism in Laramie. They hurled evil names at us because we're a different color. That went on until I moved to Cheyenne here in 1979. I moved here. During that, it slowed down and it calmed down. Racism kind of went undercover in my experience. This is how I lived my life and how I feel. It went undercover. The Band-Aid has been ripped off in the past 8, 9, 10 years. Now racism is surging forward again. We see it with this bill. That's what I see in my experience as a 71-year-old Hispanic American, proud Hispanic American that has worked his whole life, contributing member of society, paid my bills. I've gotten in scrapes, but I've paid my dues. And this is what I see with this bill. We should be ashamed of ourselves. I heard the Honorable Senator Steinmetz talk about terrorists entering this country. Who instigated the attack against the Capitol on January 6th? That's a question that nobody, I feel, is willing to answer at this time. There's a lot of people here that are coming here for a better life, and we should accommodate them. That's the American way. We're a melting pot. When I was in school, they taught us we're a melting pot, and here we are. I went to St. Lawrence School for 9 years. I'm not saying I'm the most religious person in the world, but I did learn a lot about Christianity and how to treat people.
There goes the timer.
We're supposed to treat people as we would like to be treated.
Thank you, sir.
Thank you.
Are you testifying for the bill? We're on 4 now. Is there anybody who would like to testify for this? I just stated the rule right before you came up. That was the last testimony I would take open, and then I was gonna go for and against. And if there's nobody for it, then we don't take any against. If there's nobody against, we don't take any for. Is there anyone testifying for this bill? Is there anyone online who wants to testify for this bill? Go ahead and raise your hand. Okay. With that, I will have to close public testimony. We only have so much time, and we do have to get back to the chamber by 1:45, so. But you are, you and anyone else in the room are more than welcome to email us any of your comments. We welcome that. We do get phone calls, text messages, emails. All of those are appropriate ways to contact any member of the committee. So please don't hesitate to let us know how you feel. With that, I will close public testimony. Committee, what is your pleasure?
Move the bill.
It's been moved by Senator Kolb. Probably I'm gonna ask if there's any amendments, but the easiest thing would be if somebody wants to move the Steinmetz amendment, Amendment 1 to 124, we can dispense with that all at once.
Mr. Chairman, I'll move the entire amendment.
Okay, so amendment number 1 to Senate File 124, known as the Steinmetz Amendment, has been moved. Is there any discussion on that amendment? All right, all those in favor signify by saying aye.
Aye.
All right. Were there any other amendments to this bill? Senator Craigo, you've been flipping through statutes over here, making me think you're gonna come up with something.
No, sir. Just rereading.
Just rereading, okay. What about page 16 and the 31-7-111?
Mr. Chairman, do we have a copy of that was presented?
Yeah.
Not representative.
Did you get something, Pierre?
Chairman, or Mr. Chairman, absent that.
Let's see do you have something in writing for us? Let's take a look. I mean, if we can't get it, then, we can't do it, but I just want to make sure we're.
This piece right here is.
Probably too substantial for us to work at this time. Yeah, it'll have to come at a later time if this bill moves forward. Okay, any other amendments to this bill? Any discussion on this bill? Senator Crum?
It's really concerning to me. We've got two things here. One, we've got to make sure that the folks that do come into our state are legal and doing the right thing. And we heard a lot about a lot of really good right things being done. And at the same time, we've got to be concerned about racial profiling, that we aren't treating individuals differently than anybody else. And I'm sitting here today looking at an 18-page bill with amendments and with a proposed amendment that I really haven't looked at yet. I got to tell you, I'm not ready. We may vote, but I'm not ready to vote on this without more study, more time, and more discussion on this bill.
Okay, other discussion on this bill? Senator Kolb and then Senator Craigo.
Yeah, thank you, Mr. Chairman. I'd like to get off the subject about racial profiling. I think it's inappropriate. It's not true. It has nothing to do with this bill. Nothing. I'd like to just make a comment here. My wife's a naturalized citizen, and I went through the process, and let me assure you, it is hell to go through the process. It takes a long time and a lot of effort. It's very difficult, but came in legally, got citizenship legally, and my wife's a proud citizen. So I don't buy off on any of this profiling, because this is about people doing something that they shouldn't be doing. And they get pulled over and they get found out that they shouldn't be here. And I do know there is an issue with getting automobile insurance. I do know that's a fact. And we've had people that hit people without insurance. And it was, I'm sure, all correlated to this. So I think this does something we need to address. Now, is this bill perfect in its state? No, it's not perfect in its state right now. But it can be amended a little bit, go on the floor and get it into a better condition for my purposes. So I am in favor of this bill for those aforementioned reasons, Mr. Chairman.
Senator Craigo?
Thank you, Mr. Chairman. So, and I know we're running out of time, but I feel like it's a pretty important issue. So
yes, please.
Really, there's a lot going on in this bill. I mean, a lot. And if we were just dealing with the criminal aspect and making sure our law enforcement had the ability to ask the right questions at the right time with the right level of proof or the right level of suspicion, I'm all for that. I have no problem with that. But I mean, there's so much in this bill. For example, as I read this, right, we go to page 6, it says no, any person who knowingly hires, contracts with, recruits or refers for a fee an unauthorized alien. So as I read that, as a lawyer, if I get called and asked to represent an unauthorized alien in court, I cannot do that, or that will be a crime. I cannot contract with someone who happens to be here illegally. I can't even though they're guaranteed that right under the Constitution, I can't defend them. And neither can any of my colleagues. Neither could you, Mr. Chairman. And so there's a whole bunch of holes in this, and I appreciate what the good senator's trying to do. I really do. We have a big issue, and it has some wide-ranging issues that go along with it. But I'm just worried about what rights we're going to trample on by trying to close a hole. It's probably not even ours to close, right? This is a national issue. And like I said, if we were just dealing with the criminal aspect, fine. I mean, we had our hospitals up here and I didn't ask them the question. I don't think they can provide medical care to someone here who's here illegally, period. They cannot contract with them. There's some provisions in here for emergency. What constitutes that? I don't know. But if we were just dealing with the first 4 or 5 pages, I'm all in. But when we start getting to all this other stuff, it's just really, really complicated. And so I'll have to be a no. I assume it'll go to the floor and I will work to clean up as much of it as I can, Mr. Chairman.
Senator Steinmetz?
Mr. Chairman, if I could just sneak back up.
Okay.
If you want to amend some out of the bill, go ahead. I know we took a wide swath. So if there's something you want to amend out, go ahead. Thank you.
I think that provision definitely needs addressed, the contractual. I think it does raise an issue for hospitals and for lawyers, for accountants, for anyone.
Mr.
really.
Chairman, I'm open to you deleting that.
Okay. Any other discussion on this bill?
Mr.
Senator
Chairman,
Crum?
Mr. Chairman, like Senator Craig, the premise of this bill I get, and I'm all for. You know, we need to make sure that people enter this country legally. I've had relatives come in that it's taken years, and I get that. And people entered illegally, knowing they entered illegally, coming across the border, which wasn't right. That just wasn't right. But at the same time, there's a whole bunch in this bill that we've got to, in my opinion, correct. So I'm 100% with the premise, but there's so many things in here that just lead to things, unintended consequences, I guess. So right now, I'm not for this bill. I'm for the premise that people come to this country legally.
Any other discussion on this bill? Senator Kolb?
Yeah, Mr. Chairman, I would make a motion to amend and strip page 6 under line 5, violations and penalties. Strip the section out of the bill.
Everything that's 9-25-103?
Yes, Mr. Chairman.
And so that would carry over to page 7, 1 through 3 as well. We'll call it the Crago Amendment, since it's the amendment you should have made.
I like that.
Mr. Chairman,
Senator Hicks?
page 5, line 13, strike everything under Title 9. It goes all the way over to page 6.
Kate, is that friendly or do you want it as a separate?
Friendly amendment.
Okay. That's the employer verification section that we also heard concerns about. Okay, so Pierre, are you tracking on that? Yes. That has to be cleaned up? Yes. Okay, any other discussion on those amendments? All those in favor signify by saying aye.
Aye.
Any opposed? All right, that amendment does carry. All right, is there any other amendments or discussion on this bill? All right, Pierre,
Mr. Chairman.
Senator Craigo.
So I'm gonna make this proposal because I think it would finish cleaning up what I'm worried about.
Okay.
I would strike the remainders of pages 7, 8, 9, 10, and 11.
Hold on.
Second on that, if you need one, Mr. Chairman.
7, public benefits.
Yep.
8, public benefits, 9, public benefits, and 10. So you're just deleting the statute, and
9,
11,
That's right,
you're deleting 9-25-104.
correct.
And this would be the government, basically, government providing a service to an illegal
Correct.
immigrant. Okay. Any other discussion on this amendment?
Mr. Chairman,
Senator Hicks?
just to make sure that staff, that we'll have a conforming amendment in the title. So those will be just all the way through the more technical corrections, but just to make sure that we capture those.
You got that, Pierre? Yep. All right. Any other discussion on that amendment? All those in favor signify by saying aye.
Aye.
Any opposed? That amendment does carry. Any other amendments or discussion on this bill? Okay, we'll do a roll call vote on Senate File 124.
Senator Craigo,
Aye.
Senator Crum,
Aye.
Senator Hicks,
Aye.
Senator Cole,
Aye.
Chairman Olson.
Aye.
5 ayes.
All right, Senator Steinmetz. Hopefully we didn't Frankenstein your bill too much, but I think it's gonna work. All right, with that, we are adjourned. We had one more bill that we carried over that we're gonna have to carry over again. I believe it's Senate File 180. We'll hear it tomorrow during our noon meeting.